Cope de Saber near the midline of face, contralateral Jacksonian epilepsy, trigeminal neuralgia, and ocular findings are component of. So these are component of Pierre-Romberg syndrome. Other name is progressive hemifacial atrophy, progressive facial hemiatrophy, or Romberg syndrome. Now, what is Romberg syndrome? It is a degenerative condition. It is a degenerative condition that is characterized by atrophic changes affecting the one side of face. So what you will see is the atrophic changes that are seen on the one side of the face. The onset of the syndrome is usually the first 2 decades. So there is atrophy of the skin and subcutaneous structure in the localized area of the face. The hypoplasia of the underlying bone may also occur. The most important feature is Cope de Saber. What is Cope de Saber? It is like a strike of sword, like a sharp line of demarcation that resembles a large linear scar between the normal and abnormal skin near the midline of forehead, also known as linear scleroderma. So it is just like a strike of the sword and a sharp line of demarcation that is seen in the midline of the forehead between the normal and the abnormal skin. Ocular involvement is common, and the most frequently ocular involvement is the inophthalmos because of the loss of periorbital fat. Trigeminal neuralgia may be seen occasionally, or epilepsy may develop. The mouth and the nose, they are deviated toward the affected side. Atrophy of upper lip may expose the maxillary teeth. So on microscopic examination, what you will see is skin that reveals the atrophy of the epidermis and infiltrate of lymphocytes and monocytes. The atrophy typically progresses slowly for 2 to 20 years and then it becomes stable. We can do plastic surgery that may be tried to improve the cosmetic deformity, or orthodontic therapy that might be given, and it might be helpful to treat any associated malocclusion. About the Mulkerson-Rosenthal syndrome, it is a neurological disorder that is characterized by recurring facial paralysis, swelling of the lip and face, usually the upper lip, and development of fold and furrows in the tongue. Other is Beckwith-Wiedemann syndrome. It is condition that affect the many part of body. It is also classified as overgrowth syndrome. That means the affected infants are larger than the normal, that is macrosomia, and some may be taller than their peers during the childhood. And last is the Mesicher syndrome or Mesicher cheilitis. It consists of inflammatory disorder with known infectious and known necrotic granulomas and appears as painless enlargement of lips with or without facial edema, producing both aesthetic and functional deformities.